Hello everyone. So today I'm going to discuss the case that I posted on my story around 2 weeks ago about a 49-year-old female who presented to me in primary care clinic with symptoms of stroke. So I asked you guys a question that how can we manage this case in primary care clinic? And many of you responded, and to be honest, all the answers were correct. However, all of you missed one point, that was how to manage this case in primary care clinic, not in the secondary care hospitals. For example, some of you said blood thinners, some of you said thrombolysis, some of you said CT scan. That all of these are correct. But can I do all of this in primary care? I cannot. So what am I supposed to do as a primary care physician? So I'm a GP. The lady comes to me and she says that she has difficulty in breathing. I try to clarify a little bit and I notice that she clearly has slurred speech and she has drooping of her face on one side. So this quickly gives away that she is having a stroke. Now, how can you quickly assess if somebody is having a stroke? There's an assessment called FAST assessment. The FAST assessment means F is for face, if you see any drooping of the face. A means arm yani any weakness or any numbness on one side of the body, arm or leg, hemiparesis which we call it. S means speech, any difficulty in speaking, slurred speech or no speech at all. And then the time. Time means that time is very important. The quicker we diagnose that it is a stroke and the quicker we manage it, the better the outcome is. So this assessment can help everyone, doctors as well as the non-medical people. If you see anyone is having these symptoms in your home, quickly take them to the emergency because this means they're having a stroke. So her examination was normal other than the slurred speech and drooping of her face. Her examination was unremarkable. Her vitals showed blood pressure of 200 over 118. Vitals also include blood sugar, by the way, never miss the blood sugar. Her blood sugar was 5.1. Her saturation was normal. She was afebrile and her heart rate was also within normal range. So the next step I did was I did an ECG. Why doing an ECG is important? Because it could be an embolic stroke. Embolic stroke means that maybe the patient is having an MI and that plaque which she is having in the heart, that broke off and it traveled all the way from her heart to the brain via the blood flow, causing the stroke as well. So the patient might have a heart attack with a stroke at the same time. So that is also very important to know because the management will differ in that case. You'll have to treat two cases spontaneously. While if the ECG is normal and the patient is not having a heart attack, then it is a thrombus most likely in the brain. So this is, while I'm doing all of this, by the way, when I shifted her to an emergency room, I have already called an ambulance because this patient has to be shifted to a secondary care hospital. Now, people who said that we should give her aspirin, okay, that's not wrong. But can I give aspirin to a patient in primary care clinic? No. Why? Because there are two types of stroke. There's an ischemic stroke and there's an hemorrhagic stroke. How do I know that it is ischemic or hemorrhagic in primary care without doing a CT scan? I cannot, right? So if, let's say it is a hemorrhagic stroke and I give aspirin to that patient, aspirin is an antiplatelet. It is a blood thinner. So I'm going to worsen the hemorrhage the patient is already having. So I cannot give aspirin without knowing which type of stroke the patient is having. So in primary care, you do not give aspirin without confirmation, and I don't have a CT scan in primary care. Some people said that we can thrombolize the patient. Yes, we can thrombolize the patient again. First of all, we need to know whether it is hemorrhagic or ischemic because we cannot thrombolize a hemorrhagic stroke. Secondly, there is a time window for thrombolysis. Specifically, if the patient is having an anterior stroke, we have to confirm from the patient that since when they have developed the symptoms. If the symptoms are within the time frame of 4.5 hours, in that case, yes, we can thrombolize the patient if they're having ischemic stroke. However, if the 4.5 hours window is exceeded, then we cannot thrombolize the patient. My patient said that she's having the symptoms since yesterday 2 p.m. and she presented to me at 7 a.m. in the morning. So it's almost a day, more than 12 hours. So we cannot thrombolize this patient if she's having an anterior ischemic stroke. So in a quick summary, when a patient who is having stroke comes to you in primary care, you quickly assess the patient, shift them to emergency room, you call the ambulance. Meanwhile, you do the vitals, you stabilize the patient by checking ABCDE. You also insert an IV cannula to keep the vein open, because we have to make sure that no time is wasted when she needs any medication in secondary care hospital. And we refer the patient to secondary care hospital. Yeah, one more thing. Most of you said that we need to lower her blood pressure. Again, that is correct. But again, according to guidelines, if the patient is having an ischemic stroke, we should not lower the blood pressure within the first 48 hours unless it is higher than 220/110. Why is it that? Because in the first 24 to 48 hours, if we lower the blood pressure in an ischemic stroke suddenly, they can go into more hypoperfusion, and more hypoperfusion can cause more ischemia. My patient's blood pressure was 200/110 or 118. That's why I didn't give her any antihypertensive. The second thing, a hemorrhagic stroke. We should lower the blood pressure in hemorrhagic stroke slowly, reaching to a target of 140 by giving IV infusion of labetal. But again, I do not know if this is hemorrhagic stroke, so I cannot lower the blood pressure at the moment. When she goes to the hospital, she does a CT. If it turns out to be hemorrhagic stroke, they will start the infusion there and they will slowly lower the blood pressure around 140. So basically, this is the management of a stroke that presents to you in primary care clinic. So stabilize the patient and refer them to secondary care hospital for further management, specifically for the CT scan. Take care. Bye.